Hi, I'm Dr. Erica Latcher from the podcast Straight from the Horse Doctor's Mouth and Spring Hill Equine Veterinary Clinic. And today we're going to talk about all things muscle disorders. Special shout out to our patrons. Without you guys, we can't do what we do. So thank you very much. All right, let's talk about, to start with, what parts of the horse are affected with tying up. And the big ones are these big muscles back here. Each side of the haunch on a horse weighs about 90 pounds and that's muscle. Like most of that is muscle. These are the big ones that they use to propel themselves forward, to stop, to do all the things we ask athletic horses to do. And so that's why they're the ones that are affected the most when horses tie up. So when you've got a horse and you're suspicious that they're tying up, you want to get up here and poke on these muscles and see. You can see on Gigi we have some give here, and that's what you want to see. On a horse that's tying up, they're going to be rock hard all the way through, and if you go to touch the muscle, they're going to be extremely painful to even the lightest touch. So getting to know your horse and what's normal for them is key. For most horses, it's going to only be these muscles. For the subset of horses with Myofibular Myopathy, which we're going to go over, so don't be like, what'd she just say? Those horses can often be exquisitely back sore and stiff. Like you'll put your hand on their back and it feels like you are on a 2x4. So you want to keep an eye on where your horse is sore. They're not usually sore in their necks or shoulders. They just don't seem to be affected by it nearly as much, and it's because those muscles are much smaller. It's not that they don't do a lot of work with their front ends. It's typically that we just have smaller muscles, and so it's divided up into a kind of a different cross-sectional area versus these guys right here. This is one giant muscle right here that pushes this hind leg forward. So check the butt, check the back. So let's talk about muscle disorders. We've gone over where we typically see problems in horses and why we see them there, but what can cause all that? The simplest one is exertional rhabdomyolysis. And this is, think about you after a hard workout or when you've done something that you shouldn't have because you think you're still 16, but you're not, you're nearly 50, and you wake up the next morning and your muscles are really, really sore. That is plain old exertional rhabdomyolysis, and that is our fancy name for what most horse people refer to as tying up. That's the horse who's stiff and sore. You know, they had a rough day the day before. You can sort of see how it all goes together. You tried to go for a trail ride, you got lost. Things just went awry. Everybody's sore the next day. This is typically a horse where this happens once. It's never happened before. We can point to an event and we can say something happened, and we're going to monitor that horse. We're going to make sure that they get through the event okay, and it's probably never going to happen again. As a veterinarian, the big things we look for are pain to the extent that the horse is sweating. That's a really big deal. And we want to monitor their urine. If their urine is super dark, it means that they're actually excreting the dye, basically, that makes your muscles red. And the kidneys don't do well with that. And so we have to be really careful that those horses stay hydrated so that they don't overwhelm their kidneys and then go into kidney failure. And that's going to be true for a lot of the diseases we're going to talk about today, but not all of them. So in particular, if you've got a horse that's tying up and you're like, oh, it's tying up, which one of these categories do I have? The most important thing is, how is your horse systemically? Are they so painful that they're sweating? And is their urine dark? Need to call your veterinarian that you have a great relationship with. Okay, moving on from exertional rhabdomyolysis, we're going to go to recurrent exertional rhabdomyolysis. Now, you're like, that just means it happens more than once, right, Doc? Nope, that's not necessarily the same deal. This is very common in young thoroughbred fillies. It is thought that there is a genetic link, but it's not been 100% found. So it's not like we can look at it and say, oh, there's the deal. It's also thought to do with calcium metabolism, but again, not 100% clear. What is known is that for many of these horses, once they get out of an intense environment, they grow up, they learn to handle stress a little better, we don't see it nearly as often. So again, those young, typically 2 to 3 year old thoroughbred fillies are the most commonly affected, although any young horse can be. These horses are typically noted to have a personality that is excitable. And again, it's not clear how all of that fits together. These horses can be managed with medications, and then change of environment can be a really key deal. But also just letting them grow up seems to improve things significantly. So with this disease, you're definitely going to need help from your veterinarian to modify kind of how the environment is being handled, maybe do some behavior modifying drugs along with behavior modifying training, and then also the drugs that are used to manage this disease while it's going on. Again, these horses can do all the same things. They can have the dark urine, they can be sweating, but we can usually point to an incident that caused it to happen. So that's recurrent exertional rhabdomyolysis. Okay, next we have PSSM1 and PSSM2. And PSSM stands for polysaccharide storage myopathy. And what that indicates is that when we look at a muscle biopsy, we see polysaccharide stored inappropriately. So that's just our fancy way of saying the muscle doesn't store glucose the way it's supposed to. It actually builds up these big pockets of the glycogen in the muscle, and then it's not released appropriately during exercise. The biggest difference between 1 and 2 is that 1 we have a genetic test for. It's most commonly seen in halter horse lines of the quarter horses and then associated stock breeds like Paints and Appaloosas. PSSM2 is the more common type that we see. The other problem with PSSM2, there is no genetic test that is reliable. You will see them. They have not been scientifically validated, so they are not good tests. So don't spend your money on a PSSM2 genetic test, at least prior to the year 2023, because there isn't one. They may come out with one, but as of 2023, there is not a test. These PSSM can be seen in many, many, many different breeds of horses. So this was commonly called Monday morning disease. And what would happen is that you would have horses that worked during the week, Monday through Friday. They were off for some period of the weekend, maybe Saturday, maybe just Sunday. When they came back into work on Monday morning, it was noted that they were stiff and sore and they couldn't move. What we've learned is that this is because of that inability to store glucose properly, or glycogen, in the muscles. And that is the energy the muscles need to move. These guys are relatively manageable. The big deal in terms of finding that you've got one of these is that they repeatedly tie up, and it may be from relatively mild exercise. So it may be that you went for a little bit of a trail ride, or you did something that was maybe a hair past what your horse normally does, and the next day they were really inappropriately sore over their muscles. We can also see this as just performance decline. So we have a horse who is 8 to 10 years old, they've been doing great, and all of a sudden the performance just isn't where it's supposed to be. We may see kind of a shifting hind limb lameness, and it's usually hind limb, kind of as we talked about earlier about the muscles that are affected. So that's why it's typically a hind limb issue. We may have a rider just reporting that the horse is a lot stiffer than it used to be. These horses can go into that more severe form where they're sweating and they're doing the dark urine, they're doing all of that. Most of the time these days anyways, a lot of us will catch them a lot sooner. The key to both of these types, PSSM1 and 2, is diet management. And that diet is high fat, because we need to give the muscle a different energy source than glycogen. And so fat is the key to them. We also need to make sure these horses have enough protein in their diet so that they can repair the muscle that's been damaged as they're going. And many of these horses I've been able to maintain in high level competition just by getting them on really high fat, high protein diets and giving them a lot of a little exercise. They don't handle rest really well. They don't handle big changes in exercise, but if we can get them on a program and keep them there, they do pretty darn well. So that's PSSM1 and 2. All right, this next one, Myofibular Myopathy. This one gets us. And I had one of these when Dr. Valberg, who does most of the research on muscles in the United States, was just beginning to diagnose this. And it was an endurance horse, which is where this was originally diagnosed, was Arabian endurance horses. And this horse would go do a 100-mile endurance race and would come up really, really back sore, which, as we talked about earlier, you know, typically it's hindquarter muscles when we have tying up. The other thing is this horse would be really sore, but not kind of as sore as a typical tying up horse. You know, it would still move, it would still do all the things, but it was definitely causing performance limitations for this horse. The other thing is typically when we have a horse tie up, we have some very specific blood values we see. We see very high muscle enzymes. And when I say high, I mean like we have to dilute our samples out to be able to even get down to a number. Like they're in the millions. And this horse didn't have that. And it turns out that it had a relatively newly recognized thing called Myofibular Myopathy. And this is similar to PSSM, but it happens a little bit different. The other problem with myofibular myopathy is that these horses can't be maintained by diet alone. They often have to you have to finagle kind of what their system is to keep them happy and get them on high protein diets. So we don't have great therapeutic options for this, but a lot of times knowing which one of these your horse has is super important for moving forward, because as you can see, we've just talked about 5 things that look a lot alike and may be very different. All right, let's talk briefly about Myosin heavy chain myopathy. That's a lot. This is now tested for in the 6-panel test for quarter horses. So if you have a 5-panel negative horse or a 5-panel tested horse, this test was not included in that, but in the 6-panel test, you do get this one. And it is also known as immune-mediated myositis. It is a genetic mutation. We do have a test for it and we can find it. Horses who are what we call heterozygous, that carry 1 copy of a normal gene and 1 copy of this gene, can often do really well. Unfortunately, they may also have symptoms, and we don't really know which horses of those are going to have bad symptoms or less bad symptoms. So it can be a little bit of a risk and a great reason to genetic test a horse before you buy them or breed them. What this looks like is a horse who has gotten a vaccine and all of a sudden loses muscle mass. Typically there's a vaccine involved, but not always. And the Strangles vaccine is the most common one that causes this. And these horses very quickly just lose their entire top line. And again, you'll see them urinate the dark urine, and it's the dye from the muscles that makes it red coming out. When we know that we have one of these horses, thankfully we've got great genetic testing, then we can manage them before vaccines to minimize that risk. We also recommend not vaccinating them for strangles, just because that is the most common one that we have the risk with, and we'll really split up their vaccines and treat them ahead of time with typically some steroids. However, some of these horses can go on to develop what we call non-exertional rhabdomyolysis. So these horses haven't done a thing, or they can have the immune-mediated myositis, and we don't know what triggers it. So something in the environment triggers them to lose that top line, and we may never find the trigger, or they may develop really bad tying up with no exercise associated with it. Those horses unfortunately have a poor prognosis for an athletic career, but for many of them we can manage their environment and try to get them back to at least having a quality of life. All right, let's talk about seasonal pasture-associated myopathy. This is also a relatively new one, and the most important thing you need to know is, do you have box elder trees? We don't have box elder trees in Florida, so I haven't seen one of these. But if you have box elder trees, you need to know about this. Typically, the worst cases are seen in the fall, and they look like a horse suddenly tying up, but it's been out on pasture. There are great strategies to manage this, but the biggest reason I mention it is because this horse will look like a PSSM 1 or 2 or an exertional rhabdomyolysis, and that's not what they are at all, and they require a very different therapy. So know if you've got box elder trees in your pasture, and then you can find strategies for how to manage it. Talk with your veterinarian about how to manage the trees being in there. The big thing is making sure that your horse always has access to forage so that they're not foraging for those box elder trees. But big one to know about. All right, this next round is called the vitamin E muscle disorders. and they are all due to a vitamin E deficiency. The big one we see is equine motor neuron disease, and that is related to horses who don't get enough vitamin E during the winter. Again, being in Florida, not something I see because we typically have green pasture here at all times of year. But this disease is commonly seen in more northern climates where horses may come into the barn over the winter and only be getting hay that doesn't have high vitamin E content. These horses develop a weakness, kind of a stumbling gait, and they just don't have good muscle tone. The good news is, if it's recognized quickly, it can be treated with very, very, very aggressive vitamin E therapy. And I mean very aggressive. The bad news is, once it starts happening, most horses can't go back to an athletic career. We can get them back to happy and relatively healthy, but if we start to exercise them again and put them back into athleticism, then they seem to regress. So the key point on this one is supplement vitamin E to your horses if it's during the winter and you're only feeding hay. Vitamin E deficiencies also show up in another way, and this one is a bit devastating, and it's equine degenerative myeloencephalopathy. This is a disease that occurs later in a horse's life. We typically start to see them around 5, 6, 7, it may be a little bit later, but it's associated with a vitamin E deficiency in the first year of life. So the person who has the horse when this starts to develop may not have even been around the horse as a yearling, and so they may not know that there could have been a vitamin E deficiency. This is a devastating disease. These horses go from being wonderful, happy, athletic companions to extreme behavior changes. They become very neurologic, and unfortunately, we have to rule out every other cause of this. And the only way we can confirm that this is the actual disease they're experiencing is after death. We have to look at a certain part of the brain, and then we can say, yep, that's what the problem was. So the moral of the story is, make sure you supplement your horses with vitamin E if they're in the barn in the winter and they're only getting hay, if they're less than 1 year old, and if your veterinarian tells you to. So you should probably talk to your veterinarian, again, that you have a great relationship with, about how vitamin E fits into your horse's life. And finally, let's talk about Shivers. Shivers is most commonly seen in warm bloods and the draft breeds. It's also most commonly seen in geldings and horses over 16.3. It has been found to be associated with a very specific brain, with a very specific part of the brain, the cerebellum in particular. That's part of your brain down here. And the cerebellum is responsible for taking actions and making them go from, I have to think about like throwing a ball, right? So I have to think about that motion, to you do it enough and all of a sudden you're not thinking about it, you're just doing it. Once you're not thinking about it, it goes to the cerebellum. And we think that's where the problem happens here. Because many of these horses, when you see them, they do great. Walk, trot, cantering, they move forward, no problem. What they don't do well is slow, deliberate movements. And that's where the name Shivers comes from. One of the first places you typically see this is when you lift up a hind leg. They'll pick the leg up and they'll hold it and they'll shiver. And they're not cold. They do seem to be painful, although we're not quite sure the source of the pain. But these horses definitely don't find this to be a comfortable experience. So they'll lift that leg up, they'll hold it. You may not be able to then take the leg from them. They can be very difficult to shoe. And many times the first person who knows there's a problem is the farrier. Again, this disease is a bit progressive, so we typically start to see it as the horses reach that kind of 5 to 7 year old range, and then it is progressive. Most horses will be slowly progressive, and so they can continue to have athletic careers. Some, however, will be rapidly progressive, and we don't know the difference. There's probably a genetic component, since it seems to happen in certain lines, but honestly, we just don't know. And no diet really helps with these horses, since it is more of a brain disorder than a muscle disorder. The way we diagnose it is often just by symptoms, because as you can imagine, we can't diagnose the brain disorder while they're still alive. These horses will be negative on all of the testing that we do for the previous muscle disorders. So they will have normal muscle enzymes, they'll have normal muscle biopsies. You know, we won't really be able to find an issue with their muscles. They also aren't terribly responsive to diet changes like high fat, low starch, any of the types of diets that are out there. So they can be difficult horses to try to pin down. Typically where we get the diagnosis is as the disease progresses, and then they really pick that leg up and hold it and shiver it for you. And then you're like, oh, there we go, we got a Shivers horse. Or they begin to have extreme difficulty backing up. That seems to be the hardest gait for them, and it's probably because it's a very intentional gait for horses. They really have to think about it. So that's Shivers. So I hope you learned a bit about muscle disorders today. The big key with muscle disorders is that a lot of different things can look the same from the outside. And the only way you can tell is through that great relationship with your veterinarian and working our way down a diagnostic tree. Blood testing, muscle biopsies, and oftentimes some dietary trials to see what happens are keys to helping us diagnose these. But as you can see from what we've talked about, there's a lot of different versions that require a lot of different types of therapy. So make sure that you contact your veterinarian and have them help you work your way through. Don't wing it on this one. And again, I want to send a special shout out to our patrons. Thank you guys for all you do. We can't do what we do without you.